Welcome to Drawing Heart Anatomy. As it is the week of Halloween, I decided to get into character and go with my tried and true Miss Frizzle costume and the hair dye, and so that's what's going on. I'm going to try to do the Drawing Heart Anatomy video in one take, which makes me feel like the professional skateboarders and mountain bikers that do like their amazing tricks in one take. That's what we're going to try here. So to put things in context, this is the worst heart I've ever drawn, but the actual heart is about the size of a fist and a half in the mediastinum in your thoracic cavity, and it varies, of course, person to person, but in general it's kind of relative to body size usually, not always. So start with a better looking heart than I have, and I would grab a black marker, blue, and a red. We'll use red to show oxygenated vessels and blue to show deoxygenated, although please note, blood is not actually blue, but it is more like a bright red and muted red, or like a darker red. So we're going to start with putting the heart in situ. So this would be my right side, and then this would be the patient's right side. So it looks a little bit different than what you might think. So right and left. And now let's start with, so this would be the end, the more superior end of the heart, and then down here, the inferior portion is referred to the apex. In real life, the heart is slightly over to the left, kind of slightly left of the midline, and I found out recently mine points slightly down to the left. I guess it's not supposed to, but there it is. So we'll start with our 4 chambers. You want 2 smaller chambers at the top, right and left, and then a septum dividing them. Sorry that this looks like a Teenage Mutant Ninja Turtle abdomen. I tried my best. So, keeping in mind the right and left on here, we're going to label this. This is the right side atrium. And the reason we call it an atrium, or I should say a way that you can remember that this is atrium, is because usually when you enter a giant building like a stadium, for example, like Lambeau Field, for example, the first portion that you go into is called the Lambeau Field atrium, and it's a ginormous, like, welcoming room, high ceilings, all of that. So the first room you come into, like the lobby or the atrium, this is the first chamber that deoxygenated blood enters when it returns to the heart from the systemic vessels. So, blue marker. Deoxygenated blood coming into the right atrium, and also up from the systemic there, this is also deoxygenated. We call these vessels the vena cavae, or vena cava. There's a superior one and an inferior, and they both meet directly dorsal to the heart, and they dump into the atrium kind of behind it, or dorsal, I should say. So this would be like step 1 in this process. So those are both vena cava, and I tried my best to get this situated here for you. All right. So, as the blood deoxygenated comes into the right atrium, I'm going to put number 2 is the right atrium. Separating each of the chambers of the heart are a valve. So kind of like the Titanic had watertight doors, the heart also has something kind of similar, in the sense that we want blood to always be flowing in the direction that it's supposed to, and not backwards. So these valves are actually shaped, this isn't the best way to show it, but they're shaped kind of like this. So they open and blood flows out, but when they close, blood can't like push them back in. If they were engineered this way, it would be really easy for the blood to maybe scoot back into the chamber that it's not supposed to go into. So the chambers kind of look like this instead. And they have different amounts of valves on them. The first valve that deoxygenated blood encounters is called a tricuspid valve because it has 3 little cusps on it that kind of open sort of like that. I've got better pictures in your book. Pages 402 to 404 actually have some nice diagrams of this. So we're going to draw in a little doorway, I guess. So that is a tricuspid valve. So I will say that this is stop 3 for blue, or not really blue, deoxygenated blood. After blood passes through the tricuspid valve, it is now into, it's still on the right side of the heart, but this is no longer the atrium. We're down here in a ventricle. Both ventricles, right and left, are larger than the atrium. Atria, sorry. So number 4 stop for blood is right ventricle. All right, next, blood has to go pick up some oxygen before it comes back into the left side of the heart and gets pushed out to the rest of the body. So how blood goes and gets oxygen is it needs to leave the heart, and it's going to do so, it's going to do so by way of another valve, and it actually stems from the right ventricle, but goes like around kind of the dorsal side of the heart and then comes out. The vessel does. So we're going to draw a valve kind of there-ish. It's also a tricuspid, but it has a specific name. It's actually a pulmonary valve. Pulmonary referring to lungs. This is the valve that is the gateway to the pulmonary arteries that go to the lungs. So this would be stop 5 for deoxygenated blood. Okay, next stop, pulmonary artery. There's one big one that this valve opens to, and it kind of goes, actually, let's see here. How can I draw this? Kind of up and out. It's not my best drawing. I'm sorry. So deoxygenated blood, up and out the pulmonary artery. And in this case, so think of arteries start with A, and away starts with A. So arteries always take blood away from the heart, whether or not it's oxygenated. So in this case, the pulmonary artery is an artery, but it's the only artery that carries deoxygenated blood. Artery. Okay, so after the blood, let's see. Oh, stop number 6 is the pulmonary artery. Now blood is going to head out towards the right and left lungs, be taken down into arterioles and then capillaries and venules and veins until the blood gets into the pulmonary veins. There are 2 of them. That's how it returns to the heart, and now it's oxygenated. So again, totally not to scale on the lungs. All right. So stop number 7 for blood is going to be lungs. They pick up O2 and they drop off CO2. And return, sorry, my screen went black, and they return to the heart with oxygenated red blood cells. So we'll now pick up the red marker. Let's see, how am I going to do this? Alright, so number 8 would be pulmonary veins. Oh, I guess you can't see what I'm drawing, sorry. Okay, you might have to zoom in if you can on that, I'm sorry. Alright, how am I doing on time? 10 minutes, oh boy. Okay, so stop 9 for blood. We're now on the left side of the heart. We're in an atrium and it's the left side, so it's the left atrium. Alright, let's see. So stop 9 is left atrium. Blood is now going to pass through another valve. This one is also a tricuspid, but it has a special name called the mitral valve, right between the left atrium and left ventricle. So it also has 3 cusps, or 3 little flaps to it. Mitral valve. So that would be stop 10. Blood comes through there. It's now in the left ventricle. The left ventricle, actually the whole entire left side of the heart, is far larger. The walls, the myocardial walls, are far thicker than the right side because it's from the left side that all the blood gets pushed out to the systemic blood vessels. So it's way meatier and beefier and more robust. Similarly, where we're going to head next is through our last valve, which is actually a bicuspid, only 2 flaps, 2 cusps. It's called the aortic valve, and that would be stop number 11 for the blood. It's from here then that blood gets pushed out the aorta, which is the artery with the largest diameter, and it's the thickest artery in the entire body. It's phenomenal if you've done a heart dissection and you get to put your finger in it and just feel it. It's so thick, and like rightly so, because it's dealing with the highest blood pressure that you have in your body, because that's where blood's being pumped from. So I'm going to do dotted lines to show the aorta because it actually kind of comes like behind the whole heart. Sorry that this is getting slightly crazy here. And what it actually does is come up and form this aortic arch. So I'm going to say aorta is stop number 12. 13, aortic arch. And then aortic arch actually branches off into like carotid artery that goes up into the neck. Brachial and subclavian comes to the arms. And then the rest of the aorta comes inferior to the heart and then goes to the rest of the, the torso, the lower limbs, and all of that. So, I hope I do not forget anything. If I do, I will make sure to post that in addition to this video. So, overview of the heart. Left side is way thicker and bigger. Like if you cut a heart open, you can literally fold it in half, kind of like a hamburger bun, and see that the left side is phenomenally thicker. The right and left sides are separated by this little septum, and what actually opens and closes these valves are little things called chordae tendineae, and that's their nickname is heartstrings. So when someone's tugging on your heartstrings, they're tugging on the tendons that open and close your valves. That wasn't that funny. So maybe that doesn't work that well, but in general, the size of a fist and a half, located in the mediastinum, thoracic cavity, and flanked by lungs that don't actually look like that in real life. Sorry. And I think that's about it. So, your overview of drawing heart anatomy with Ms. Frizzle. I hope that was helpful, and if you have any questions or need to see this better, I can direct you to some other